Hi, my name is Jim Koski. I'm a physical therapist here at Orthopedic and Spine Center. And today I'd like to talk to you about some exercises that you can do prior to hip surgery. Okay, so the first part is you want to stretch and warm up the hip area. So what we're going to do is, my assistant here, Jen, she's going to do what's called a single knee to chest stretch. So she's going to grab one knee, pull it into her chest, the other leg is nice and straight. She's going to hold that for 30 seconds, 3 times. Once she's done with that, you want to just pull until you feel a nice stretch. If you're feeling pain, then don't pull as hard. The next stretch, what we're going to do is called a piriformis stretch. So she's going to bring her leg up. She's going to grab her knee with that hand, her ankle with this hand, and then she can pull this towards the opposite shoulder, all right? And then she can play around with wherever she feels tightness and feeling a stretch. From here, if she wanted to, she could push this knee away and get another stretch. Some of these might be a little uncomfortable if you have arthritis in the hip, so just be careful on how much tension you're putting on the stretch. From there, what we're going to do is what's called a IT band stretch, you know, the side of the hip. So Jen's going to flip over on her side. She's going to have her leg nice and straight, and she's going to hang it off the back side, off the bed. And we're going to get this stretch right in here. So we stretch the back of the hip and the side of the hip, which helps take some pressure off of the areas that are arthritic or painful. You want to stay in this position for 1 to 2 minutes. Low load, long duration stretches is how I prefer to have people stretch. From there, then what you can do is she can sit up on the side of the bed. So let's sit up here. This is called an upper trunk rotation stretch. Jen's going to go ahead and put both hands on the side of the bed. She's going to twist and turn, and then the key is to drop the head. The head tensions all the back, all the way down, so she'll feel a stretch from her neck all the way down her back to her tailbone. 30 seconds on this side, and then she's going to switch over to the other side. Notice how she turns, drops the head down, that tensions everything, and then she feels a nice stretch in there. If you can't twist so far, you know, all you have to do is just put your hands just slightly to the side, just both on, and just get a little rotation in her shoulders, and once again drop the head as the tensioner. So after you finish those 4 stretches, then we're going to go ahead and do some strengthening. So Jen's going to stand up. She can come over here and use a wall to stabilize herself. She's going to do leg swings. So she's going to swing the leg that's affected or she's going to have surgery on. So this is going to help do some dynamic movements and stretching and stretching. So her left leg is the one that's going to be operated on. So she's going to swing it out to the side 10 times, and then she can swing it forward and backwards 10 times as well. And she can do this 2 or 3 sets. And then she can turn around, and we're going to do the other side. So even though we're moving the leg that's not going to be have an operation, the side that she's standing on is getting stabilized. So it's using other muscles to help stabilize the joint. So once again, she'll do 2 or 3 sets of 10 of those. Okay, from there, here's a more difficult one. She's going to do what's called a wall sit. She sits up against the wall. She leans up against the wall. She puts her feet out in front of her, and then she's going to slide down the wall. Okay, Jen's pretty good at this, so she can slide pretty much down to parallel, perpendicular to the floor. And then if you can't do that, you can modify it and come up a little bit higher. What this does is it tensions all the hip and the muscles that control the hip, so it's a good strengthening exercise for her. From there, our next strengthening exercise is going to be bridges. So she's going to lay down on her back, bend both knees, and she's going to lift her bottom up off the bed nice and high. See how nice and high she gets with it, nice and level? Most people can't get up this high. That's all right. All I want you to do is just try and get your bottom off the floor and then down. You don't have to hold it. She can come up and down 10 times, 2 sets of 10. So go ahead and go up and down a couple times. Okay, excellent. Okay, and then the last exercise is called clams. We use this little elastic band. We put it around her legs, around her knees, and she's going to lay on the side. This is going to be the side that she has the operation on. Bend the knees, keep the feet together, and she's going to spread her knees up and down. Once again, 2 or 3 sets of 10. That's going to help strengthen the small rotator muscles in the hip and to help with the recovery. All these exercises are really good to do prior to your surgery. It'll help with your surgery recovery, and then it also help when you go to physical therapy. You'll know some of the things that you'll be doing. Okay? Thank you very much for watching, and if you have any questions, feel free to comment. We'll see you later.